Okay, so first thing we're gonna do is check our provider's orders. We're gonna go see Mr. Smith. He has a chest tube because he has a pneumothorax, so we're gonna go check on him and evaluate that. Hi, Mr. Smith. How are we doing today?
Pretty good. How are you doing?
Good, good. My name is Ellie. I'm gonna be your nurse for the next 12 hours.
Hi,
Really
Ellie.
quick, can you tell me your first and last name and date of birth?
Yeah, I'm Bob Smith, September 10th, 1980.
Perfect. All right, Mr. Smith, I am going to start out by taking some vitals, okay?
Okay.
All right, so I would take a full set of vitals. I also would just do a quick respiratory assessment. I would note that he has some diminished sounds on the right side, which is to be expected for him. I would also check his oxygen saturation and make sure that that is in the level that we want it. And then I would also do a quick pain assessment. Mr. Smith, can you tell me how you would rate your pain on a scale of 1 to 10?
Probably around a 4.
On 4, okay.
Yeah.
And what kind of pain are we feeling?
I just feel kind of achy.
Achy?
Yeah.
Okay. All right, well, is it okay if I lift up your gown? I'm just gonna check your site really quick.
Yeah, that's fine.
Okay, so I'd provide some patient privacy. I'm gonna lift up his bed. All right, Mr. Smith, I'm just gonna lift up this gown right here.
Okay.
All right, so before I touch it, I just want to look at the site. I'm noticing if there's any drainage coming out. The dressing is dry and intact, which is a good sign. I'm just gonna notice if there's any abnormal swelling, any abnormal colors. I'm gonna note the length that the tube is in there at and make sure that that's the correct length that they put it in at. All right, Mr. Smith, you're gonna feel my touch right here on your side.
Okay.
And I'm noting any crepitus, if there's any drainage that comes out. Is this tender at all to the touch, Mr. Smith?
Maybe a little bit.
A little bit? Okay. Alrighty, so next I'm going to palpate my tubing. Just going down, making sure I'm looking for any clots in the tubing, any kinks, any dependent loops. Normally this would be on the floor. So I've palpated from the patient to the chamber. Now I'm going to palpate from the chamber up to my suction chamber over here. Again, just noting any abnormalities. Everything is connected. Good. All right, so now I'm going to take a look at my chamber here. I'm going to notice the type of fluid that's in here. It looks like serosanguinous to me, which is to be expected. I'm going to note the amount that's in there as compared to last shift. And then next I'm gonna look over at this side. So I'm gonna note, we want this little orange bellow to be all the way to this arrow. It's not currently. The suction is on, so this just tells me that we need to turn this suction up. So then once we do that, the bellow is gonna come all the way to that arrow, which is a good sign. And then we notice a lot of bubbling here, and that is abnormal. So what we're gonna do for that, I'm gonna take my clamps. I'm gonna start up by the patient and I'm just gonna kind of clamp here. I'm gonna keep going down. And this is just telling me I'm looking for an air leak. So the bubbles have stopped and this is more what we want. So this tells me that there is a leak somewhere from here up to the patient. So I'm gonna look for my leak and I'm just gonna watch how this responds to it. Ideally, this ball we would want to go up and down with the patient's breath, and in here we would notice a little bit of titling again with as the patient breathes. We would notice that, but yeah, so I'm going to keep my clamps here, and I want to have a dressing here, some sterile water just in case we need to pull that tube out. I'm going to turn this off just so it's quieter. Okay, Mr. Smith, everything is looking good. I want you to kind of help me out here. At your site, I want you to give me a call if it starts to get more painful, if you notice that dressing is wet. It was dry and intact, so I don't think we need to change the dressing, and the tube is secure, so we don't need to worry about that. Biggest thing I want you to watch out for is if you start to have a hard time breathing, like you feel like you can't catch your breath, if you get any tightness in your chest, Any signs that could indicate any type of respiratory distress, I want you to call me on your call light. Or if you are just noticing a lot of pain at the site that's abnormal. So we've educated the patient on signs that he needs to be aware of for infection and respiratory distress. Mr. Smith, as you recall, when you were in the car accident, you sustained a rib fracture, which punctured your lung, and you have something called a pneumothorax. So me and your team are going to monitor this. We're gonna keep up on our x-rays and everything, and doctor will know when we're at a good point to go ahead and discontinue that tube and pull it out. So for now, we're just gonna have you sit tight. We're gonna monitor this super closely. I'm gonna make sure that he's safe. So I'm gonna put the bed in a low and locked position. His side rails are up. Mr. Smith has his call light in case he needs anything. And then as far as documentation, I want to document the type of drainage that we see, the amount, if anything was abnormal with the chamber. I want to document his vitals, any education that he received. So those are the signs of infection that we talked about, and signs of respiratory distress, and of course just how he tolerated it and how he's doing, just kind of generally. So Mr. Smith, do you have any other questions for me?
I don't think so.
Perfect. Okay, so then we would go document.